Hand washing. Use a barrier. Cut on your water faucet. You want to use warm water during the skill. Make sure that your watch is up so that it allows you to wash your wrist. Wet your hands first. Apply soap. Provide 20 seconds of friction to your hands. Make sure you get in between your fingers, around your wrist, and up and down every finger. Last, clean your nails. Clean around each cuticle and under every nail. When you rinse, be careful. Try not to touch the sink. If you touch the sink, you have contaminated your cleansed hand. Be sure to remove any soap that's remaining on your skin. Cut off your water. As you dry, be sure to only start at the part that has been washed and is wet. Pat your hands dry. When the napkin becomes saturated, get another one. And now you can perform your skill on your patient. Blood pressure. Select the appropriate size cuff based off of your patient's or resident's arm size. You'll need a blood pressure cuff, your stethoscope, and alcohol. Clean the diaphragm of your stethoscope as well as your earpieces. If using a double stethoscope, make sure you clean your earpieces and the instructor's earpieces as well. Mrs. Jenkins, may I take a blood pressure on your left arm?
Yes.
Support the resident's arm. Make sure that the end of the cuff is 2 finger widths above the antecubital area or the inner bend of the arm. You want the cuff at the level of the heart. From the pinky up, locate your brachial artery. This is where you would want to place your stethoscope. Safely inflate your blood pressure cuff. For your first blood pressure, do not go above 160. Slowly decrease the pressure on your cuff. The first thump you hear is called the systolic blood pressure. The last thump you hear is the diastolic blood pressure. Remove your blood pressure cuff. Document your numbers. And clean your equipment at the end of your skill. Miss Jenkins, I'm here to do your pulse and respirations. I've already washed my hands and I've closed the door for privacy.
Okay.
And I'm going to begin now. Count the pulse for 1 full minute. Then watch the resident's chest rise and fall for another full minute. 1 exhalation and 1 inhalation equals 1 breath. Okay, Miss Jenkins, I've finished your pulse and respirations. I'm going to go document now. You have your call bill. Anything else I can do for you?
No, thank you.
All right, thank you very much. Wash your hands and document. Miss Jenkins, let's make sure your feet are flat on the floor. We're going to get you to the scale and weigh you today, okay?
Okay.
All right, on the count of 3, I'm going to help you up. 1, 2, 3. Are you dizzy?
No.
All right, let's slowly walk to the scale. Let me stop you. I'm going to 0 the scale first. Let me assist you onto the scale. Very good. I have an arm behind you for safety. Very good. Let me help you step off the scale. Okay. And can you turn around for me? We'll walk slowly to your chair. Document your findings, wash your hands, and give the resident the call bill before you leave the room. Feeding. To perform feeding, you will need a clothing protector, washcloths, water, a spoon, and the food of the resident's choice. Gather your supplies and move your bedside table. Miss Jenkins, I need to raise your head before we start feeding you.
Okay.
How are you doing today?
I'm good, thank you.
Would you like applesauce or pudding?
Applesauce, please.
Okay. Would you like to wash your hands before we begin?
Yes, please.
Raise your patient to a minimum of 60 degrees. Wet half of a washcloth and leave the other half dry. Miss Jenkins, wash your hands, please. Thank you. Take soiled linen to the hamper and apply gloves before feeding the resident. Jenkins, I'm going to put your clothing protector on. How have you been doing today?
Good, thank you.
Put this around your neck. Is it okay if I sit you up a little more?
Oh, absolutely.
This is for your safety. We don't want you choking. I'm going to start off with some water. Did your family come by yesterday?
They did.
Very good. Did they bring the puppy?
They did. It's getting big.
Start off with some water. Did it go down? You wipe your mouth. You like this applesauce. Yes. Make conversation with the resident. Use a spoon to feed. Good. And make eye contact. Can I see if it went down? Good. Very good. And one more bite for me. Very good. Can I give you some water to wash that down with? And I'm going to wipe your mouth again. Would you like some more to eat?
Yes, please.
Very good. When you're feeding a resident, always make sure they're swallowing before you proceed with the next bite or any water. Just want to make sure. Open up. Very good. Some water. You did so well today. You're eating much more.
I have an appetite finally.
Yay! Clean up your supplies, take off your gloves, wash your hands, and then document the food intake in percentages. I'm going to save this in case you want it for later. When you're removing your linens, remove them away from you so that you do not contaminate yourself or clothing. Place your linens in the hamper. Take off your gloves. Wash your hands. I'm going to document that you ate 25% of your applesauce. And we're almost done. Let me take off your clothing protector. You have your call bell. Would you like to be lowered any?
No, thank you.
Is there anything else I can do before I leave you?
I don't think so.
You have a great day. The next skill we will be demonstrating will be mouth care brush teeth. You will need a clothing protector, a washcloth, toothbrush, toothpaste, a cup of water, and an emesis basin. You also must wear gloves for this skill. Miss Jenkins, we're going to raise the head of your bed.
Okay.
I have to sit you up some more, okay? I'm sorry. Let me know if it's causing you any discomfort. Is that okay? Apply your clothing protector. You can sit up for me just a little bit. Thank you. We don't want to get anything on that beautiful gown. Would you like to rinse your mouth before we start?
Please.
You can either swallow it or spit it out, either one you like. You swallowed? Wet your toothbrush first. Got your favorite flavor toothpaste, bubble gum. Apply a small amount of toothpaste. Brush all surfaces of the teeth and the gum line. And you can close for me. Get them together. And I got gloves on. Let me get around. Very good. You have beautiful teeth. I don't want to hurt you. Am I hurting you any?
Mm-mm.
Make it up top. Do you need the rinse now? Or can I go to your tongue? Stick your tongue out. And I'll apologize if I'm hurting you. This for me. We're going to have you rinse again, okay? And then I'll wipe your mouth. Rinse again. And wipe your mouth and your chin so I can make sure everything's dry. How do you feel now?
A lot better, thank you.
I'm going to clean up my supplies and I'll be back to remove your clothing protector. To the toilet and flush. Rinse your equipment. Dry your equipment. Disinfect if the nurse asks you to. Store your equipment. Do not contaminate the door handle. Have a separate barrier for the door. Any supplies you've yet to store, go ahead and do so now. Close your cabinet back. At most test sites, the toothbrush is disposable. Miss Jenkins, I'm going to go ahead and lay you back some, okay?
Okay.
Is that okay?
Mm-hmm.
You have your call bell. Is there anything else I can do for you?
No, thank you.
Tidy up your room. Take off your gloves. Wash your hands and exit the room. Before providing denture care, line the bottom of the sink with a washcloth to protect the dentures from breakage. Use cold water only on your dentures. Remove your dentures from the denture cup. Wet your dentures. Wet your denture brush. Apply toothpaste or denture cleanser. Brush all surfaces of the denture, including the gum line. Rinse your dentures and also rinse your brush. When you're storing your dentures in water, place water up to the gum line. Remove your washcloth. Place it in the soiled hamper. Get a clean barrier to store your equipment. If you're performing denture care in the state of Florida, denture care is a two-part skill. After performing denture care, take off your gloves, wash your hands, apply new gloves, and then proceed to brushing the resident's teeth. I'm ready to perform your hair and nail care. Would you please test the temperature of the water? Is that okay? Would you soak your hand, please? Sure. I just wanted to verify it was okay. I'm going to start off with your hair while your hand is soaking.
Okay.
You have such pretty hair.
Thank you.
What hairstyle would you like today? Would you like it as it is right now?
That's fine.
Okay. I'm going to comb your hair in small sections. Let me know if I'm hurting you.
Okay.
Did you get to go outside today?
I did.
Very good. Let me see you one more time. How do you like your hair, Miss Jenkins?
I like it.
Looks very good. I'm going to fold this washcloth up a little bit more so that I don't contaminate myself. How does that feel?
That's good, thank you.
Gonna go in between your fingers. Your soap smells good. And we don't want that soapy washcloth falling in our water. And I've rinsed your hands. Going to clean under each nail. You doing okay, Miss Jenkins?
Yes.
Did I hurt you any?
No.
I'm going to move this basin out the way. And let's dry your hand. Your nails are already filed, so I'm just going to go over just to make sure that everything's smooth, no jagged edges.
Okay.
You've been taking great care of your nails. Remove any nail dust. Warm lotion in your hand. And then give your resident a massage. That feel good?
Yes, thank you.
Remove any excess lotion. Make sure I get all that extra lotion off you. Very good, Miss Jenkins. Rinse, dry, and store your equipment. Make the area tidy. Take off your gloves and wash your hands. Miss Jenkins, I'm ready to do your foot care. Would you like to test the temperature of the water?
That's fine.
Okay. Make sure you have all your supplies before beginning foot care. Miss Jenkins, I'm going to support your foot. And I can't put your foot on the bare floor. So I'm going to make sure I put it in the water, and you've already tested it. Let me check again. Go ahead and go toe first. Still okay? Very good. I'm going to apply my soap. Bring your foot out the water for me. Let me know if I'm hurting you, okay?
Okay.
And go in between each one of those toes. And I'm going to go under your foot as well. So just roll your foot back. Okay, how does that feel, Miss Jenkins?
Wonderful, thank you.
Very important for me to dry in between those toes. I don't want you getting any infections. Am I hurting you?
No.
Lift up for me. Let me make sure the bottom's dry. Good. Our toes are dry. Our ankle and our foot is dry. I'm going to apply my lotion. And I apply lotion everywhere except for in between your toes, okay? And then I remove the excess. How did that feel?
Great, thank you.
I'm glad you liked it. Rinse, dry, and store your equipment, and that completes your skill. Miss Jenkins, you called? You need to use the bedpan? I'm going to start by lowering the head of your bed. So that we don't expose you too much, I'm only going to do it from the corner, okay? I'm going to lift up the corner of your sheet. Can you bend at the knee for me? And raise up off the bed. Very good. Let's get your pad down. Let me get your bedpan. If you'll hold on to your tissue for me. And we're going to do the same thing all over again. Bend at the knee and raise up. Very good. I'm going to raise the head of your bed. It'll make it easier for you to go to the restroom that way. And I'm sorry to reach over you. Here's your call bell as well. I'm going to step out the door. Call me whenever you're ready to get off the bedpan. I'm right behind the curtain if you need me. Miss Jenkins, you called. Are you done?
Yes.
Did you wipe yourself already? I'm going to lower the head of your bed. And can you raise up for me? Very good. Trash. Pour out my fake contents. Barrier. Sink. Pour. Your bedpan should go on the lower shelf of the cabinet. May I have your toilet tissue? Close the cabinet with the barrier so that you don't contaminate the cabinet. Remove your gloves. Miss Jenkins, before I leave, would you like to wash your hands?
Yes, please.
Half is wet and half is dry. Would you like your head of the bed up any?
No, thank you.
Thank you. Wash your hands. Leave your resident with the call bell, and you are done with your skill. Good morning, Miss Jenkins.
Good morning.
I'm here to change your position.
Okay.
Is it okay if I do so now?
Yes.
All right, can you scoot toward me some? Very good. And now we're going to turn to your left. Are you okay right there? I'm going to put this pillow behind your back just to make sure you're comfortable, okay? We don't want you getting any pressure sores. Can you come back on it just a little? How does that feel?
Good.
Very good. Now I'm going to come around to the front and adjust your other pillows. Okay. The first pillow we're going to put down is going to be in between your legs. It's to help protect your knees and your ankles from getting sores, okay?
Okay.
Don't want to uncover you too much. Just lift at the knee a little. Very good. Our knees aren't touching and our heels aren't touching. Very good. Here. I'm going to give you a pillow to hug so that I can stop you from laying on your arm. And then the last pillow is going to be the one under your head. Can you raise your head for me? I want to make sure it's under your neck and not under your shoulder. And here's your call bell. Is there anything else I can do for you?
Nothing.
Okay, I'm going to wash my hands and open the curtain. You have a good day. Are you ready to get into the wheelchair now?
Okay.
I'm going to start by raising the head of your bed.
Okay.
Is this your first time up today?
Mm-hmm.
We'll be gentle. I know your legs are weak. I'm going to start by preparing the wheelchair. We want to make sure that we transfer you safely. Unlock my brakes. Bring my footrest up and put the leg back. And do the same on the opposite side. Lock the brake, footrest up, and bring your leg back. I'm going to bring the wheelchair up just a little bit closer now. Pull back your covers. And because you don't have socks on, I'm going to go ahead and put your shoes on your feet now so they don't touch the bare floor.
Okay.
Thank you, Miss Jenkins. With your upper arms, can you scoot toward the edge of the bed for me? Very good. And I'm going to help you sit over the side of the bed and dangle. Use your arms and help me.
Okay.
On the count of 3, we're going to scoot you over. 1, 2, 3. Very good. Let's get your legs right. Are you dizzy? Get your hair right before we get up. I like to pull this closer now because I know you can't take a step and I don't want any injury. When do you have physical therapy again?
Tomorrow.
Wonderful. Raise your arms up for me. We're applying your transfer belt. Is that too tight?
No, ma'am.
And our feet are flat on the floor. I want my wheelchair at a 45-degree angle. The nurse doesn't want you taking any steps, so I'm going to bring you up and then pivot you and put you in the chair. Okay. Let me get a leg between yours for safety. I'm going to put my weight on my rear leg. And if you can hold my shoulders. I'm going to rock you a little. Okay. 1, 2, 3. Very good. Can you scoot back in the chair for me? Good. I want to make sure I do not drag your feet. So I'm going to help you put both feet on one footrest. You want to pull your wheelchair out a little. Put the other foot on the opposite footrest. We're almost done. I just need to take off your gait belt. Let's cover you up so nobody gets to see you. Thank you. Sorry. Are you all the way back in your chair? I left you in the wheelchair with your brakes locked. Here's your call bell. Your nurse will be in the room in a few minutes. Is there anything I can do for you now?
No, thank you.
Okay, I'm going to wash my hands and open up the curtains. Thank you. Hello again, Miss Jenkins.
Hey.
Hey, I'm here to change your bed linens. May I start now?
Okay.
I've washed my hands and I've already closed the curtain. I'm going to move your call bell so it doesn't fall off the bed.
Okay.
You're having a good day so far?
Thank you.
Let me set this here, Miss Jenkins. We don't want your bell falling. I'm just going to bring your top sheet in just a little. I don't want to expose you, but I don't want to get it caught when I'm changing your linens. What did you have for breakfast this morning?
Applesauce.
Ooh, we have to give you more than that, Miss Jenkins.
I wasn't very hungry.
Okay. Will you try to eat more for lunch today? Okay. Let me know if you need some help with your tray.
Okay.
You've been doing very well with your turns. Can you come toward me a little? Very good. And now I'm going to ask you to help me turn you to your left. I'm going to cover you up in the back. Don't want to leave any wrinkles under you. Very good, Miss Jenkins. Lay back for me. Can I get you to scoot toward me, please? Very good. And now turn to your opposite side. You doing okay?
Yes, ma'am. Thank you.
Anything hurting?
No.
Very good. No wrinkles under you. Can I get you to turn back? I'm going to go take this one to the linen closet, and I'll be right back, okay? I'm sorry if I had you exposed for too long. Are you getting cold?
No, okay.
Hopefully tomorrow we can get you out the bed. I know you'll be happy.
That sounds nice.
And get you in the wheelchair maybe. Don't want to get those toes caught. Thank you for lifting up for me. I'm gonna make your linens neater. Let me take this to the hamper. I tucked your sheet at the bottom. Last time you didn't like the military corners. Do you want me to do them this time?
Mm-hmm.
Okay. Wiggle your toes for me. Let me make sure you have enough room. Good. You sure it's not too tight on your toes?
I'm sure. Thank you.
You're welcome.
You take good care of me.
I try my best. You're a wonderful patient to care for. And the last thing we have to do is just change your pillow case. I'm going to roll this one inside out so it's easier to put back on, okay? Can you lift your head? Thank you. Very good. I didn't want to shake the pillow and release any germs in the air, okay? Raise your head for me. You feel okay?
Yes, thank you.
Here's your call bell. Is there anything else I can do for you?
No.
I'm going to go wash my hands and open the curtain, and I'll see you during my next rounds.
Okay.
Thank you. Jenkins, I'm here to do your upper extremity range of motion.
Okay.
Okay, let me know if I hurt you. Okay, I'm going to support your extremity, and we're going to start off from going to the bed up to the pillow. Okay. 1, 2, 3. Are you okay?
Yes.
We're still working the shoulder. Okay. Going to go out and in. 1, 2, 3. You're doing very good. Can I continue?
Yes.
Let's rotate that shoulder. 1, 2, 3. Very good. Okay, now we're going to work your elbow. You ready? 1, 2, 3. Down to your wrist.
Okay.
Very gently. Down, 2, 3. Are you okay?
Yes.
We're going to go side to side. 2, 3. And the last one, we're going to rotate it, okay? 1, 2, 3. I'm going to start with your thumb. Bend it in. 1, 2, 3. Good. 1, 2, 3. I'm making sure all your joints move. 1, 2, 3. 1, 2, 3. And last finger. 1, 2, 3. Okay, it's time to rotate the fingers. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. How did that feel?
Good, thank you.
You did very well. I'm going to give you your call bell. There you go. Alright, I'm going to go wash my hands, open your curtain, and just call me if you need anything.
Okay.
Wash your hands and open your curtain. I'm here to do range of motion on your lower extremity. May I start now?
Yes.
Okay, I've washed my hands and I've already pulled your curtain. I'm only going to expose the leg that I need, okay? I'm going to support your hip, and we're going to start by raising your leg. All right. 1, 2, 3. How does that feel? Okay. We're going to go out and in. Okay. 1, 2, 3. And then the last exercise for the hip is going to be rotation. 1, 2, 3. Did that hurt any?
Mm-hmm.
And we're going to exercise your knee. Let's put Bring it up. 1, 2, 3. Very good. And now we're down to the foot. I'm going to exercise your ankle. We're going to bring the ankle down and up. 2, 3. Now we're going to do side to side. 1, 2, 3. And the last exercise is going to be rotate. 1, 2, 3. Everything okay?
Yes.
You did very well. And straighten back out your covers. Here's your call bell. I'm going to go wash my hands. Is there anything I can do for you before I leave?
No, thank you.
Wash your hands and open the curtain. Good morning, Miss Jenkins.
Good morning.
I'm here to walk you. Is it okay if I walk you now?
Okay.
I'm going to use this gait belt, also called a transfer belt, to support you during the walk. Can you lift your arms up for me? Very good. Let's make sure your belt isn't loose or kinked, and you can lower your arms now. I'm going to apply the belt a little snug for your safety. I don't want it moving during our walk, okay?
Okay.
We definitely don't want you falling, Miss Jenkins. And I'm going to tuck the excess belt. Are your feet flat on the floor? Okay, let me grab hold to your gait belt. I'm holding you really tightly. On the count of 3, we're going to stand. 1, 2, 3. Are you dizzy?
No.
Okay, let's take 10 steps. Go ahead. 1, 2, 3, 4, 5, 6. Very good, Miss Jenkins. Can you turn for me? Before we begin, are you dizzy? Okay, let's walk back to the chair. You're doing very well. And your last turn, and we're going to sit down slowly. You did very well. Let me remove your gait belt. I don't want to pull your skin. Here's your call bell. Is there anything else I can do for you?
No, thank you.
I'll be back to check on you during my next round.
Okay. Eunice, I'd like you to dress the resident with a weak right arm.
Yes, ma'am. I'm going to start by washing my hands, and I'm going to pull my curtain.
Okay.
Wash your hands. Put on gloves if required according to your state instructions. Miss Jenkins, which top would you like to wear today? The blue and white or the turquoise?
The blue and white, please.
I'm going to start by dressing the resident's feet. I'm going to put socks on first. Miss Jenkins, let me know if I hurt you any. Gathering up the pants legs. And do the same for the other side. Jenkins, I'm going to pull your pants up. Don't want to expose you too much. I'm going to pull the covers back down at the foot of the bed. Let me just check for wrinkles. Very good. No wrinkles there. Ms. Jenkins, I know you have a weak right arm, so I'm going to start off on your left side. I'm going to help raise you up so I can untie your gown in the back. Let me gently lower you. Am I hurting you, Miss Jenkins?
Yeah.
Don't want to uncover you too soon. Miss Nurse Evaluator, can you help me turn, please? Turning. And then I'm going to turn her toward you. No wrinkles. I'll lay her down. Thank you for your assistance. Can you trade sides with me, please? And now I'm going to turn her your way. I'm going to move her toward me. Sorry, Miss Jenkins. And turn her toward you. Miss Jenkins, it may be a little difficult to get your arm in this sweater, and I apologize. Correction if I'm overextending the arm. I'm going to get your clothes on you as neatly as possible. Don't want you to have any wrinkles back here. Thank you. Okay. Now let me straighten out your clothes. I'm going to raise you up just a little. Are you okay?
Yes.
Want to make sure your hands and your arms are straight. Your clothing has no wrinkles, your buttons are fastened, and the last thing I want to do is remove the gown. I didn't want you cold as I was changing your clothing. Jenkins, here is your call bill. Is there anything else I can do for you before I exit the room?
No, thank you.
Okay, I'm going to go take this to the dirty hamper, wash my hands, and I'll be finishing once I open the curtain. I'm going to go wash my hands. Open the curtain. And done. I'm here to perform perineal care on Miss Jenkins. Would you test the water temperature for her, please? Thank you. Miss Jenkins, I'm going to pull your covers down a little bit. Before we begin, I need to change the pad that's under you. It's already wet. This nurse evaluator, to ensure safe turning, would you be able to hold her when I turn her? Thank you. Thank you. Thank you. Ms. Jenkins, I'm going to take you over to the other side a little. Would you trade places with me? Thank you. And thank you for laying her down. Thank you. Not get you on your gown until I clean you. I'll cover you back up so you don't get too cold. And I'm going to put this in the hamper. Actually in the trash. Miss Jenkins, I'm going to have to expose your vagina so I can clean it. I'm going to clean your outer lip. We'll change positions. Clean the other. Change positions and then clean down the center. Now I'm going to rinse you. I'm going to clean your vagina first, and then I'll turn you so we can clean your rectum and your buttocks. I'm rinsing. One wipe, change position. Second wipe, change position. Third wipe, down the center. And now I'm going to dry you. Am I hurting you?
No.
Ms. Nurse Evaluator, would you help me turn again, please? I'm going to continue wiping front to back, front to back, change positions again, and then clean the rest of the buttocks. Get a new washcloth for rinsing. And repeat the steps again. Rinse, change positions, rinse the rest of the buttock, and take another towel, dry the anal area, and then dry the rest of the buttocks. Thank you, Ms. Nurse Evaluator. I'm going to take my supplies, my used linens, to the hamper. Try my equipment. Excuse me. I don't want to contaminate the door handles, so I'm going to use a barrier, and I'm going to store this in the closet. Remove my gloves and any other supply that I need to remove. I can do so now that my gloves are off. This was not contaminated with any of the bodily fluids. I'm going to go wash my hands. Miss Jenkins, here's your call bill. Is there anything else I can do for you?
No, thank you.
Open up the curtain, and I am done with my skill. for the partial bed bath now. Would you like to test the water temperature, please? Miss Jenkins, I'm going to raise your head so that I can protect your pillow. Going to also untie your gown. You doing okay today?
Yes.
Miss Jenkins, we're almost done with your towels. I have to place one more towel. Very good. I'm going to begin your bath now. I'm going to start by washing your face. I'm going to go from inner eye to outer eye. Change positions and cleanse your other eye. Very good. Now I'm going to change again and wash the remainder of your face. I'm going to dry the same way. Inner eye to outer eye. Inner eye to outer eye. And then dry the remainder of the face. I'm going to apply 1 drop of soap, and I'm going to bathe the rest of your upper body, starting with your neck. Let me know if I'm hurting you. Neck, chest, stomach, and your sides. Very good. I'm going to do your arm now. Make sure I hit the armpits. Good. And the opposite side, doing the same thing. Good, Miss Jenkins. I'm not going to reuse that washcloth because I don't want to get my water soapy. Is the water temperature still good?
Yes, thank you.
Now I'm going to rinse, making sure I keep my washcloths and my corners contained. After I get the rinsing you, I'm going to wrap you to keep you warm. And the same thing on the opposite side. pat you dry. Miss Nurse Evaluator, would you switch sides with me, please?
Yes.
When I turn, Miss Jenkins, would you help hold her in position?
Yes.
Miss Jenkins, last one. And make sure you don't hit the table. Thank you. Putting another towel down to protect the bed. Applying soap, and I'm going to wash the back of the neck, the back, the shoulders. Miss Jenkins, am I hurting you?
No.
Miss Jenkins, now I'm going to rinse. Apply my lotion. Perform a back massage and remove the excess lotion. Thank you, Nurse Evaluator. Back situated in bed. Going to go get my gown now. Make sure you're properly aligned. I'm going to scoot you over some more. Very good. We got one side on. I'm sorry if I was a little rough with you right then. I apologize. I'm going to lift you up so I can tie your gown in the back. Did you get too cold during your bath?
No.
Leave your bed neat and tidy. Miss Ms. Jenkins, here's your call bell. Is there anything else I can do for you?
No, thank you.
I am going to empty out my bath basin, rinse it, dry it, store it, remove my linens, take off my glove, wash my hands, open the curtain, and I'm done. I'm here to perform Ms. Jenkins' catheter care. Would you test the water temperature, please? Ms. Jenkins, before we begin, I'm going to go ahead and pull the curtain. I've already washed my hands and put on my gloves. I'm going to put a pad under you so that the bed does not get wet while I'm cleaning your catheter. Very good. And I'm going to begin catheter care now. I'm going to clean your vagina first. One wipe, change position, wipe down, change positions, down the center, and we're going to use a new washcloth to clean the catheter. We're going to hold the catheter at the insertion point and clean down 2 to 4 inches. Change positions, hold, change positions, hold, now I'm going to rinse both the vagina and the catheter with the same washcloth. Down, change positions, down, change positions, down, change positions, hold the catheter, and clean it gently. And you will dry the exact same way. Down, change positions, down, change positions, down, and now finally dry your catheter. Miss Jenkins, I'm going to remove your pad as the final step. And Miss Jenkins, I'm sorry for not covering up your legs during the skill. I'm sorry if you got cold. Empty your basin, rinse it, dry it, and store it using a barrier. Put away any towels that you may have used. Take off your gloves, wash your hands. End the skill by giving the resident the call bell and opening up the curtain. Thank you. We will be performing will be emptying and recording the output from a urinary drainage bag. Apply your gloves. You will need a barrier for the floor, an alcohol swab, and your graduated container. Place your barrier on the floor. You will drain all of the urine from the urinary drainage bag. Use caution not to hit the inside portion of the graduate. Make sure that your urinary drainage bag is secured to a non-movable part of the bed, such as the bed frame. Clean the spout before placing it in the pouch. Pick up all of your items and take them into the bathroom. Place your graduate on a flat surface and maintain eye level contact to read your graduate. 575 cc's. You must now rinse your graduate. Dry it completely. Use a barrier when you're going to store your items. Take off your gloves. Wash your hands and document on the output form. Leave the resident with the call bell, open the curtain, and your skill is done. afternoon, Mrs. Jenkins. My name is Eunice. I'm your CNA today. I'm here to put on your compression hose. I'm going to begin by exposing your leg. I've already washed my hands and pulled your curtain for privacy. Ms. Jenkins, I just want to make sure that your stockings are free of wrinkles. I am now going to lower your bed, wash my hands. You have your call bell. Is there anything else I can do for you?
No, thank you.
Okay, I'm going to open the curtain. You have a great day.